Today we will be discussing critical incident analysis, or CIA. CIA is a reflective technique in which the subjects scrutinize and evaluate meaningful situations that they have either witnessed or experienced. This evaluation can take the form of individual journaling and/or one-on-one or small group discussion. In CIA, the mentor's job is to guide the nursing student or professional in 1. Identifying a critical incident, 2. Examining the incident in depth, and 3. Resolving on future actions. A critical incident is one which holds meaning, either positive or negative, for the person involved. Examining the incident involves exploration of actions, feelings, and acknowledging successes or regrets. After a thorough exploration, resolutions for future actions can be devised. In this CIA scenario, the unit manager is debriefing with a new nurse preceptor about her first week precepting a newly graduated nurse. The target audience includes nurse educators, nurse managers, and nurse preceptors. Please note that this discussion takes place in a private area to minimize interruptions and maintain confidentiality. Well, let's get on to the scenario.
Morning, Karen.
Hi, Sandra.
Hi. I was reading over your critical incident report the other day of what happened with your preceptee, and I wanted to check in with you about how you were doing.
I think we definitely had an incident that day. I think we were really busy with we had 2 patients with my preceptee, and I was in one room with one patient and my preceptee was in the other room with the other patient, and she was giving a medication. And I think she felt like she had to really hurry. And what happened was she was giving antibiotics, giving vancomycin, and she hung it, and she checked it. She did the 5 rights, checked all that, and started the medication and left the room. And then later, when I walked in the room, I found out that she'd done the 5 rights, but she hadn't connected the IV to the patient.
Oh,
so
no.
we vancomycined the floor. Yes.
Okay, and then there's something about a vanco level?
Yes. So the problem was that we had done our trough, but then we needed to do a peak after giving the vanco. But because the patient didn't get the vanco, we had to, we had to go and get another dose from the pharmacy, and that took a while because it wasn't a stat order. So then we couldn't get our peak level on time, so everything kind of got messed up. And that was the 4th dose, and it was all supposed to happen then. So yeah, it was definitely
a little bit of a kerfuffle.
Yes.
So how did you feel about that day?
I think maybe that day it was just a little bit too soon for my preceptee. Yeah. This was the first time we were taking 2 patients, and they were both kind of fairly needy, and she just hadn't got time management and things. She wasn't quite at that point where she was ready to do that yet.
Okay.
Yeah.
So you were concerned about her time management and like getting frustrated with herself.
Yeah. And then because she wasn't really good with time management, then she just hurried and didn't maybe do all the checks that she needed to do.
That she should have done. Yeah. Okay. And then, so if you could do that day over, what would you do differently?
I think maybe I would talk to her a little bit more at the beginning of the day and let her know that, even though you feel like you're, being rushed and you're not on top of everything, you still everything's still okay. Like, take a deep breath, and it's all right. Nothing bad's going to happen if you just take a few more minutes to make sure everything is, is done properly. So I think that maybe she felt rushed because I wasn't giving her that reassurance that everything was okay. So okay. Maybe I need to give her a little more reassurance. Actually, you're doing fine, and you don't need to rush, and it's okay. Everything's going well.
All right.
So I think I would definitely do that.
And then, so it sounds good. Like you've thought about what you could do differently. And then, what about your your goals for the next time that you're with her. Have you thought about that?
Yeah, I have thought about that actually, and I think that because she's kind of not quite ready for taking on maybe 2 more difficult patients yet. I'm going to see if there's a possibility that there's maybe like an easy pair for her to do, like a couple of easy patients that she can still work on her time management skills, but yet not feel like that she's out of control and has to rush.
That sounds like a good plan.
Yes.
All right. Good job.
Thanks for checking in, Sandra.
Of course.
I appreciate it.
You're welcome.
Hello. Through viewing this module, I hope you have seen how critical incident analysis can be a useful tool for nurse educators, nurse managers, and nurse preceptors to encourage reflective practice. This can be done through journaling or discussion in a private and confidential setting, and mentors can guide students and nursing professionals to identify critical incidents, to evaluate their experiences, and plan for future practice. Through the use of critical incident analysis, we can learn to evaluate experience to improve clinical performance.